We now have so much data about ourselves. From watches that monitor your heart rate 24/7 to your phone counting your steps, we can quantify ourselves like never before. But all of this data can be a curse. Out of the dozens of numbers that your watch gives you, which is the most important number for your health? Whether you're a data nerd like me, or just want to use the numbers your watch gives you to get a bit healthier, this video is here to help. We're going to look at resting heart rate during exercise, step count and VO2 max, explain what they are, why they're important, and how to use these numbers to optimise your health. And to help me get to the bottom of all of this, I decided I needed to talk to my favourite YouTube cardiologist. Hey Rohin, thanks for joining me.
Hey Andrew, how's it going?
Hang on, why am I Skyping you?
Sorry, I'm just on a call with Andrew Steele.
I thought I'd start by asking Rohin about what's obviously his favourite organ, the heart. So let's kick off with our first number. What is resting heart rate? How would you define resting heart rate?
Well, this is your heart rate at rest, so that typically means when you're not doing anything for at least a few minutes, so about 5 minutes of inactivity while you're awake.
And so what is a normal resting heart rate and what's a healthy resting heart rate?
The normal range in medical textbooks is 60 to 100 beats per minute. But if I met a patient and their resting heart rate was in the 90s, then I'd be a little more suspicious that maybe something was going on. So a normal heart rate and a healthy heart rate aren't necessarily always the same thing. I think most people in good health should be aiming towards the lower end of that spectrum. So 60s, 70s, I think, is a healthy heart rate.
Okay, so resting heart rate is your heart rate when you're resting, obviously. And it's ideally somewhere at the lower end of the classic 60 to 100 beats per minute range. But why is it important? Well, for such a simple measurement, your resting heart rate is a remarkable window, not just into your fitness, but into your health overall. This graph shows resting heart rate along the bottom, ranging from an ultra-slow 40 beats per minute to a brisk 100 BPM, and risk of death up the side. And as you can see, every increase of 10 beats per minute adds 15 to 20% to your total risk of dying. And this graph is of what's called all-cause mortality, i.e. death from any cause. Breaking this down into individual diseases, this is the risk of cardiovascular disease. It also increases as resting heart rate gets faster. It might seem obvious that people with a lower resting heart rate would have less risk of heart-related diseases, but they're at less risk of all kinds of things, even as this line shows, less risk of cancer. The exact mechanism by which a low heart rate connects to a low risk of cancer isn't fully understood. But all of this is a very good reason to care about trying to keep your resting heart rate low. So we talked about resting heart rate. I was wondering about what you can learn from your heart rate during exercise, because I think that's much more difficult to interpret when you're watching your heart rate peak and trough and all these different things. Is there much that the normal, non-athlete who isn't training for some, incredible endurance event can actually learn from what their heart rate does during exercise?
Yeah, I think that's a really important qualifier that we're talking about normal people. I'm not talking about elite athletes who may have very specific sort of requirements from their exercise. I think we can overestimate the importance of exactly what the heart rate is during exercise. I think the key objective of aerobic exercise, and this is often described as zone 2 training, which again is a bit of jargon and I think can overcomplicate things, but this means basically you're exercising, you're getting your heart rate up, but I personally don't look at my heart rate when I'm exercising. I gauge how much to exercise just by how I feel. If I can say a few words, but not a full sentence, if I'm jogging along with somebody, breathing pretty hard, then I know that I'm working out. I'm working my heart out. Then there are 5 zones in this zone system. So zone 2 is this level of exercise, and zone 5 is flat out 100-meter sprint. Kind of you can't maintain for more than 30 seconds or something. There is a general rule of thumb of 220 minus your age should be your sort of maximal heart rate, which again, like all these things, should be taken with a pinch of salt. But I think every now and again I do like to try and max out my heart rate for a short period of time, perhaps with interval training from zone 2 and just absolutely nail it for 30 seconds, see how high I can get my heart rate. But probably the biggest benefit is spending a lot of time in that zone 2 range.
So, given what we saw in the last video, the heart rate measurements during exercise are probably good enough for most of us, mainly because we probably don't really need to know our exact heart rate. The one thing I think is worth bearing in mind is how bad some of these devices are at measuring maximum heart rate. When I tested 3 different watches while out running in the last video, they all did okay for most of my run, but only one was anywhere close with maximum heart rate. And if I trusted the Fitbit's measurement, I've got the maximum heart rate of a 71-year-old. But max heart rate isn't that useful a value to be tracking anyway, and in practice you'll know when you've hit your maximum heart rate without needing your watch to tell you, because you'll be completely exhausted. Right, that's quite enough about hearts. Let's talk about steps.
There's some recent data that's just come out about steps, and I've heard a lot of people saying, 10,000 hours is just kind of plucked out of 10,000 hours. That's the wrong book. 10,000 steps, but it actually bore out in this study. They looked at people, masses. This is like another huge study where they gave smart devices out to lots and lots of people of all different backgrounds and health statuses and things. And the take-home messages from it were that not all steps are the same. So it was a lot about intent. And the other message was there was no lower limit to benefit. So 1,000 steps is better than no steps, and 2,000 steps is better than 1,000 steps. No matter what steps you do, it's always going to benefit you to do a bit more. But it did seem to really kind of, the increment became less dramatic after 10,000 steps. So it actually seemed like this is a good number to aim for a lot of people.
This was a study of almost 80,000 people in the UK, and these are the key graphs. Along the bottom is number of steps per day, and they show us how risk of death decreases as people take more steps. This first graph is about total steps, and you can clearly see that getting to 10,000 per day reduces your risk of dying by more than half. This is a huge deal, and corresponds potentially to years of extra healthy life. But getting more than 10,000 doesn't seem to make much difference. The risk of death is still low, so more steps don't hurt, but it's completely flat, with no further improvement. This blue area, by the way, is the uncertainty around the answer. And you can see that things get more uncertain as the number of steps increases because so few people are doing 20 or 25,000 every day, it's very hard to be sure exactly what's going on. And this second graph is for so-called purposeful steps, which they defined in this study as being steps taken at a rate of above 40 steps per minute. As you can see, it looks basically the same, except that you get almost all of the benefit for just 5,000 or 6,000 of these brisker steps. Purposeful 6,000 step walk, anyone? And with this in mind, if we look at the step data for the 3 watches I tested plus my phone, there's an interesting pattern. Of the steps taken in the day that I went running for the last video, 4,630 were during that run. And I'm happy to be that precise because all of the counters agreed to within plus or minus 14 steps. Just over 10,000 steps were from 2 long walks, and the devices all agree about that to within 5%. It's the rest of the day where things differ wildly, ranging from 5,300 steps on the Mi Band to almost 8,000 on the Fitbit. So they basically agree on the purposeful steps, but it's these incidental steps where the differences seem to creep in. And I found that Fitbits are renowned for overcounting steps. They'll count steps when you've literally told it that you are cycling, and therefore you cannot be taking steps. And what I found actually when I crunched the data on my watches that I was wearing is that the difference is actually in these what are called the incidental steps, the ones that you take accidentally around the house.
It's interesting that you say that because I had the same experience with a Fitbit, that it was overcounting steps. Yeah, maybe these incidental ones at home, and actually those ones are unlikely to be that beneficial. Walking around the house a little bit is fine, but walking to work rather than taking the car, that's where your real benefit's coming from.
Now let's talk about a number that is an absolute buzzword among sports nerds: VO2 max. Might sound quite complicated, but actually if you break the name down into its component parts, it's fairly self-explanatory. The V stands for volume, so the amount. O2 is oxygen, so that's the gas in the air all around us that we breathe in and effectively burns our food to give us the energy for, among other things, making our muscles work. And max, well, obviously that just means maximum. So the way this is normally measured is that you go into a lab, they'll stick you on a treadmill or an exercise bike, and all this time you'll be wearing a very tight-fitting mask, a mask that measures the amount of oxygen you're breathing in and carbon dioxide that you're breathing out. And they'll gradually ratchet up the level of exercise that you're doing until you're going absolutely flat out, your maximum possible rate. And at that point, the measurements of those gases from the mask allow them to calculate your VO2 max. This is a quantity that tends to increase with fitness, so the more you train, hopefully the higher you can push your VO2 max. And unfortunately, it's something that declines with age. And smartwatches claim to be able to give you some kind of indication of your VO2 max, a measure, an approximation worked out from your wrist, and thus a sort of picture of your overall fitness.
This is a measure of oxygen consumption in the tissues in your body. You cannot derive from a wearable device. When I've had my VO2 measured formally in a cardiopulmonary exercise test with a mask, really tight-fitting mask and everything, then somebody to say, I had the same VO2 max as you from my device. They're not the same number at all. But if that person can see their VO2 max climb over several months, then that's great. That shows progress, within the bounds of the margin of error for these devices. But yes, I would be very cautious comparing between even the same manufacturer from one person to another, and certainly between manufacturers.
The way most smart devices try to estimate your VO2 max, roughly speaking, is to wait until you're doing some kind of exercise, like going for a run, and then they look at how fast your heart is beating versus how fast you're running. And let's imagine you're running really quickly and your heart's beating slowly and calmly compared to other women your age running at that pace. They'll infer that you've got plenty of gas left in the tank and have a high VO2 max. So you can see how hard this is to get right. It depends on accurate heart rate measurements, accurate GPS to get your running pace, and it'll also have to guess at everything from the individual volume of your heart to whether you're running off-road on difficult terrain or carrying a heavy rucksack, which might mean you need to put in more effort for a given speed. Delving into the research on this, there are a handful of papers where VO2 max estimates produced by smart devices have been compared against proper lab-based VO2 max measurements with the tight-fitting mask, etc. And the results are mixed. These are the results from a couple of the more recent papers I found, and along the bottom we've got the study participants' actual lab-measured VO2 max, and up the side we've got the estimate from a watch. A perfect watch would give the same results as the lab test, meaning the dots would all lie along this line. And we can add in 2 more lines for a 10% overestimate of VO2 max, i.e. your watch is flattering you, or a 10% underestimate. Results from Garmin are the white dots, and Fitbit estimates are in blue. Neither brand covers itself in glory here. The VO2 max estimates are very scattered. Just about the majority fall between the 10% error lines, but only just. There are almost as many dots outside, meaning an error of more than 10%. And given that a 10% difference in VO2 max corresponds to about 5 or 10 years of decline in athletic performance, that's a pretty significant error. It's worth noting that these studies are looking at fairly old devices, a Fitbit Charge 2 and a Garmin Fenix 5, both of which are a few years out of date now. Current models probably are a bit better, but given that all the watches have to go on is pace plus heart rate, it's not clear how well they'll be able to do, even with newer hardware and algorithms. So, some of these numbers do have their problems, but me and the doc think that they could be useful nonetheless. What I like about these devices is they're often a more objective measure, although they're not a perfect measure, or whether you're thinking back on how many hours sleep you've had this week or how much exercise you've done. It's very easy to lie to ourselves, and the watch, although the data might be a bit inaccurate for various reasons, actually, again, as you say, if you're looking at trends, it's a much more honest broker. It can tell you if you're not getting as much sleep as you did last week or if you've not done as much exercise as you did last month.
I think steps, there's no better example. I have always thought I'm a fairly active person, and when I first started wearing, the first generation kind of devices, I was surprised that 10,000 steps, that actually takes a bit of work. It's not something that you just automatically do. I mean, days I was on call, easy, I'd double that quite happily. But, normal days, sitting at your desk for a bit, it's I thought I've done a bit of exercise today, but actually I have only done about 4,000 steps or something. I better go off and do some exercise. So that was, I think a lot of us are quite surprised how inactive we are, and we fool ourselves totally.
I've been really shocked by how far 10,000 steps is. If you want to do it in one sitting is probably the wrong word. But if you want to do it in one go, it's quite a long walk.
Yeah.
It's going to take you an hour probably. And
that's just, again, you just have absolutely no idea without having the watch quantifying it for you.
Yeah.
Right, I probably shouldn't keep you hanging on any longer. What is the most important number for your health?
The most important number for your health overall is VO2 max. But not the one measured by wearable devices. If you asked me what is the most important number that can currently be measured on a consumer wearable device, I would say resting heart rate. And both of those answers actually have similar reasons because they correlate extremely well. There's a really strong relationship between both of them and life expectancy and multiple other health outcomes. We know that patients with lower heart rates, obviously within a sort of normal range, live longer. And we know the difference in your health outcomes based on your VO2 max is dramatic. If you look at patients who are in the top kind of quarter of readings in the population versus those in the bottom, you have something like about a 5-fold difference in your cardiovascular risk.
Surprise, surprise, the cardiologist chose 2 numbers related to the heart. But I am tempted to agree. As we've seen, resting heart rate is easy to measure and has a remarkable, almost freaky ability to predict future health. And you actually don't even need a smartwatch. You can do it just by feeling your pulse and using a stopwatch, and then recording the answer in a notebook if you prefer. But there's one number that I actually think is even more important. Knowing your resting heart rate is all well and good, but what we should all be trying to do is improve or maintain it. And there was one thing that kept coming up in my conversation with Rohin. Whether you want to improve your resting heart rate, your VO2 max, or reduce your risk of heart disease, cancer, and ultimately death, there is one medicine that's better than any other.
In a nutshell, the most important thing is exercise. Exercise, aerobic, anaerobic, and resistance exercise. Exercise again. Exercise, exercise, exercise.
So I think the best number you can get from your watch is the one that will most motivate you to get exercising. My personal favourite is what Fitbit calls active zone minutes, and Garmin calls intensity minutes. These are designed because international guidance suggests that you should try to get 150 minutes of moderate exercise, or 75 minutes of vigorous exercise per week. And accordingly, every minute of moderate exercise, like a brisk walk, gets you 1 of these active zone or intensity minutes. And every minute of vigorous exercise, roughly corresponding to the zone 2 training we talked about before, will get you 2. And that means you need just over 20 a day to hit the weekly target of 150. The 3 things I like about this are, firstly, that it's a clever, simple way to make sure you're getting enough exercise every week. Secondly, that if you do a bit of accidental exercise, like a 5-minute brisk walk for the train or taking the stairs instead of the lift, that gets counted too. And finally, it doesn't rely on particularly accurate heart rate measurements, just which rough zone your heart rate's falling into. And that means it should be pretty reliable across devices. Working up to 150 minutes a week will have huge benefits for your health, reducing your risk of death from any cause by something like 25%. And if you're already getting 150 minutes a week, more continues to be better, reducing the risk of most diseases until really quite a lot of exercise. So if you can get even a bit of extra exercise into your daily routine, then an improving resting heart rate and VO2 max should follow.
I think you could also convincingly argue that the most important information you get from one of these devices is just an honest appraisal of how much exercise you have or haven't been doing. So the most important function, I'd say, is as a watch.
Many thanks to Rohin Francis, aka Medlife Crisis, for inviting me round to his studio to nerd out about smartwatches. If you've enjoyed watching me and Rohin chatting, you should go and check out him interviewing me about aging biology over on his channel. And this video is part of my series on wearables, so check out the rest of the series here. All right, guess I better move.